Hi, I'm Roy Roberts, and welcome to San Diego Made, San Diego Proud, where today we introduce you to Dr. Sarah Lucas, who is a vascular surgeon at La Jolla Vein Care. A condition known as venous insufficiency and varicose veins are major causes of discomfort during pregnancy. So today, Dr. Lucas joins us to talk about venous disease and the best approaches for women to keep their legs healthy during pregnancy. Dr. Lucas,
right.
Welcome. Good to have you here. So a lot of people probably unfamiliar with the term, maybe even pregnant women.
Yep.
Venous insufficiency. Explain that to us.
Sure. So venous insufficiency refers to pooling of blood in the legs, which can cause a variety of symptoms: leg swelling, fatigue, numbness, tingling, and varicose veins. The majority of pregnant women experience some degree of venous insufficiency, related to a multitude of factors: hormonal, increased circulating blood volume, and compression of the uterus on the pelvic veins. Our veins have one-way valves that are supposed to keep the blood going from our feet back towards our heart. But during pregnancy, those veins dilate, the valves can start to fail, blood pools in the legs, and varicose veins can form. About 1 in 3 pregnant women develops varicose veins, usually in the first trimester, and the earlier they form, the worse they tend to be.
So very common.
Yes.
Not unusual for women to experience this, but what can we do, what can you suggest for women to keep their legs healthy during their pregnancies?
Yes, and that's what the patients want to know. What can they do to avoid it or treat it?
Right.
Our approach to pregnant patients is pretty similar to our approach to the non-pregnant patient. We encourage women to stay active and to control their symptoms during pregnancy with compression stockings and elevating their legs whenever they can. It's very uncommon for a woman to require any type of surgery during pregnancy. We can usually manage them non-operatively. And the symptoms tend to get a lot better after the baby is born. However, there is a significant segment of patients who still have varicose veins and still have those venous insufficiency symptoms after the baby is born. And those women may want to return for treatment after they've completed breastfeeding.
Okay. Go on.
So I brought actually a few images of a patient who was treated.
Okay, let's take a look.
Who was treated at our clinic. She came in with really bad symptoms, severe varicose veins during pregnancy. We treated her non-operatively with compression stockings and leg elevation, and she came back after her baby was born. And as you can see in the 2 middle photos here, her legs were significantly better, but she was still having symptoms and she still had varicose veins. So on that final photo over towards the right is her final result after she underwent radiofrequency ablation and ultrasound-guided foam sclerotherapy. So the next question is whether wearing the compression stockings can actually avoid the formation of varicose veins. And unfortunately, we still don't know.
And we've got about a minute left here, so there is also the risk of blood clots, right?
Yes. So pulmonary embolism is the #1 cause of maternal mortality in the developed world. Usually a deep vein clot from the leg traveling to the lung. And in pregnancy, there's an increased risk because the blood tends to clot and the blood has a slower flow from the legs. So any woman who develops sudden swelling in their leg, shortness of breath, chest pain needs to seek medical attention immediately.
Okay, so we need to watch out for those warning signs, monitor it very carefully because it could turn into an extremely serious health situation.
Absolutely.
But of course, it's cosmetic first and well-being in pregnancy. That's what women need to focus on. What they need to do is to get in contact with La Jolla Vein Care with any questions. 858-550-0330.